Hello and welcome to all our viewers. My name is Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are in the middle of the preparations for our 2020 online tongue tie symposium coming up very shortly here in the next month at September 14th and 15th. And what we like to do here at Gold, we like to sit down with our speakers, get to know them a little bit so they share a little bit about their background, their work here with us, so you can get to know them as well. And we also will talk a little bit about the presentation at the Tongue Tie Symposium. And with me here today is Dr. Catherine Watson-Genna. Welcome. Hello.
Hi there, Kristen. You gave me a promotion. Thank you, though.
It is wonderful to have you here today, and thank you for taking the time. It's a busy time for you, isn't it, right now?
Yeah, well, lots of recording presentations for conferences that went virtual, and we
Right.
just submitted a research article and lots
Wonderful.
of stuff going on. All
Lots
good.
of stuff. Good, good. So tell us a little bit. First of all, where in the world are you located?
I'm in New York City in Queens County, equidistant between the two airports.
I see. Thank you. And we're still, impacted by COVID. Is it getting better in your area? What do you see? And how are you impacted in your clinic work?
Yeah, we are still in phase 3 of the 4-phase reopening. People are being very cautious. Almost everyone is wearing masks. Masks are
Mhm.
required to go anywhere. Many things are still closed or in very low capacity. I am seeing many more clients virtually,
Mhm.
and almost all of my physical travel has been postponed or canceled.
Right.
And I bought this really nice HEPA air cleaner for my office. I do see very carefully selected low risk families, and we wear masks and we clean everything and we wash our hands a lot. And I use a HEPA filter in my office to see people in person. So it's a big change.
That's a big change, I think, yeah, for all of us here, and telehealth as well, right? You mentioned you see some as well there. So tell us a little bit about your background. I know you're super busy. I know you're doing all the recordings here for not only speaking for us at Gold, but putting together a lot of other material. So tell us a little bit what you are working on right now. A little bit about your background. I know you also will be speaking at our Level Up
Mhm.
Learning Day for Golds, but for our listeners who don't know you yet, give us a little bit of a background here.
Okay, well, I have a biology degree, and I have some graduate work in medicine, and this was like the perfect entree to the lactation profession. My firstborn was a challenge to breastfeed, and I became a La Leche League leader and saw and spoke to many breastfeeding families and got the bug to learn more and get my IBCLC, and each, one foot in front of the other. And now I'm in this big, exciting research project and doing a
Mhm.
lot of lecturing as well. So it's been fun. It's a good
Wonderful.
ride.
Can you tell us a little about the research, or is that too soon, or you're still having
No,
it
no,
under
no,
wraps?
we can talk. So we've been basically working on methodology to look at the way nipples stretch under pressure, and
Interesting.
that's on pause right now because of COVID.
Yeah.
And our second study is using ultrasound to look at the organization of tongue movements in space and time. So we're tracking um, 30 to 40 spots along the tongue during sequential frames in babies 3 to 5 best sucks. And we've learned a tremendous amount, and we just put an article in to a physiology journal, and we're hoping that it'll be accepted. So fingers crossed for us. And then once that's accepted, once the methodology is accepted, we can write up some of our findings on larger groups.
Wonderful. Well, we hope we learned about that when you come visit us next time here at Court.
Yeah, I'd be
Wonderful.
happy to.
That sounds interesting. So let's talk a little bit about your presentation, critical assessment of apparent tongue tie. So what will you be talking about?
Well, we know that there are tremendous numbers of babies being diagnosed with tongue tie, having
Mhm.
frenotomies, and sometimes it's helpful and sometimes it doesn't help, and sometimes things completely fall apart after frenotomy. So I've been really motivated to learn about what else could we be looking at,
Mm,
what else is happening, and I've been really fortunate to be in the middle of this research project, so I've been able to do ultrasounds on babies with torticollis and babies
mm.
with poor latches and see that there are many factors, and we really have to take those seriously and rule out many other conditions when we're assessing for tongue tie.
That is absolutely interesting, and interesting also that you mentioned that. You mentioned that we're seeing a lot of information now on tongue tie. I feel like new research or new findings are coming out every day. It's an exciting time. We learn so much. But on the other side, it feels almost like everything is a tongue tie now. Is it because we're overdiagnosing, or is there really more tongue tie? Are we jumping the gun and saying like this
Yeah.
is a tongue tie, so if you'll feel like we're jumping into action too soon? And that's where your presentation seems to fall into that as well, to give us different perspectives there.
Yeah, I suspect we're overdiagnosing because we have this tool for anatomy. It's fairly simple. You
Mm,
know, it's not terribly invasive. It's not fun for anybody, but it's, you know, in the realm of surgeries, it's super, super simple. And so we're like, okay, well, let's try this, but that's not necessarily a great approach.
mm.
So I think that because we had a hammer, too many things look like a nail, and now we have to pull back a little,
Uh-huh,
and this is
uh-huh.
the way things work. Look at
Right,
tonsillectomies. Everyone had their tonsil out.
right.
Nobody had their tonsils out. Now we're taking a few out. I think we'll do the
Yeah.
same way with frenotomies.
Yes, absolutely fascinating. So, yeah, looking at other aspects as well,
Mhm.
which can be challenging because I can imagine you mentioned torticollis. Often that doesn't really fall into, maybe into scope of practice of lactation consultants. So, it sounds to me like it would be important to work with other professionals, almost like in a collaborative approach, to make sure that nothing is overlooked.
Absolutely. We really need our team. I
Mm,
have a really expert physical therapist who she's got particular expertise in infant torticollis, and I've some fabulous speech pathologists who work on feeding, and it, I'm so, so blessed to have a really good team of body workers, occupational therapists, and infant chiropractors, osteopathic physician. So I'm so blessed to have these other team members. But it's so hard on our families because
mm.
having to go see other people when they're trying to calibrate their milk production, when they're feeling miserable and needing to rest. So it's not an easy thing. And then economically, which is particularly cogent for my New York City families.
Yes, absolutely. You brought up some very valid points there, especially new families that are still, trying to establish the milk supply, resting. Maybe they had a difficult
Mhm.
birth, and then and the economic factor, of course. Not everything is covered by insurance, or
Yeah,
so going to all these different professionals is time consuming and expensive as well. So yeah.
yeah.
Before I let you go, what kind of little nugget can you give us on the way here? A little nugget of wisdom from you today.
Okay. Well, Nikki Mills has published 4 papers this year as part of her PhD research. So she's now double Dr. Mills. She's an MD, um, and she is a ENT doctor, pediatric otolaryngologist,
Mm,
and now she's got a PhD in functional anatomy. And she's published 4 papers this year, one on MRI of breastfeeding and swallowing, and 3 on the anatomy and histology of the floor of the mouth. And her findings are particularly cogent to this issue of tongue tie and confounders. Her findings are that there is a layer of mucosa, a layer of fascia, and then posteriorly in the mouth, the genioglossus muscle. And how tight everything is determines what pulls up and what the frenulum looks like. And if
mm,
the tight component is fascia, and in her histology study, 2 out of the 10 adult cadavers had more compact fascia, then
Hmm.
fascia is amenable to massage and maybe to stretching. So we may be able to do some other things other than rather than cut if it's just the fascial component that's tight, which is what I think we're seeing in the submucosal or more posterior tongue ties. So anyway, so there's lots of frontiers. It's an exciting time to be working in this area, but we have to stay agile and really keep up with the evidence. So
Absolutely. Well, thank you so much, Kathy, for sitting down here with me today and chatting a little bit of what's going on in your world and also about the upcoming presentation and giving us a little nugget of wisdom there as well for the way.
thank you so much, Kristen, and I'm so glad the hurricane missed you.
Oh, thank you so much. And to our listeners here, if you would like to find out more about this presentation that's coming up in the 2020 Tongue Tie Symposium and on all the other presentations in the symposium, please visit goldlearning.com. And don't forget, you can comment below and ask questions there as well. And we hope to see you all at the symposium. Bye bye, everyone.